I'm so delighted to be part of this group. It's wonderful. About 10 years ago, my toddler asked me, Mom, I don't know if I want to be Superman or Batman. And he asked me, what do you want to be? And I immediately said, I want to be Sue Johnson. So he said, Sue Johnson, what's her superpower? So for 10 years, we are talking about what's her superpower and why I want to be Sue Johnson. So we had a lot of discussion about Superman, Batman, or Sue Johnson, or Brené Brown. So today, actually, he's here. He's my helper. And I hope at the end of this day, he knows that why I want to be Sue Johnson and what's the superpower he has. And something I told him about in this power, that Batman and Superman, they have great powers, but they cannot give their power to other people. They can just use it. But what Sue Johnson has, she can share her power with other people. And I told him, if you come here today, you can see a lot of Superman and Superwoman, and they all have this power. So I'm here because I'm an immigrant, and I'm a wounded immigrant. And I'd like to share my story, why I'm a therapist today, and what was my process in immigration. About 20 years ago, I believe I was happy and confident, and I was pretty successful. I wasn't the place that I wanted to be when I was in Iran. So I got married, and I was pregnant when I moved to the US. From the very first day, I felt lost. I remember when I arrived to the San Francisco airport, and they opened my suitcases, and they asked me questions. I just felt, wow, who am I? Why am I putting myself in this situation? And I remember when I had to go to the hospital and check my baby, if he is okay or not, the nurse asked me a lot of questions about my insurance, and I didn't know. I had a good insurance, but I didn't know what to say or what the question is about. And she told me, do you know who is the father of your baby? So my response to all these questions was just tears. Not the only that I couldn't speak. Language was always a big barrier, and still it is. But I didn't know how to respond to this question emotionally when they opened my suitcases, when they asked me very rude questions, when I went to the hospital, and the nurse just said, because I can't speak English, I don't know who is the father of my baby. So in that time, I didn't know that I was grieving. I remember my doctor put me on antidepressant for 6 months, and she asked me to see a therapist, and I did it. During that time, I just felt I'm so lost, I'm confused, but I know I passed this stage, because I have done before. I was in war for 8 years. I was in the revolution in Iran. My parents got divorced when I was a kid. So I knew that this is another stage, and I'm passing this stage, but I really want to help other people in my situation. So I had this dream 20 years ago that I'll be a therapist, and I have a foundation for other immigrants in my situation, and I want to help them. And that motivation, of course, helped me to move on from my depression. Something I learned later, that I was not depressed, I was grieving. I didn't know, at that time, I didn't know that immigration is the biggest loss people experience in their world. When we lose someone, we lose one person. When we immigrate, we lose our home, our family, our friends, our support group, our language, the foods, the street we know, our identity, our certainties. It's a lot, and you don't experience that much of loss in any situation except immigration. And do you know how I learned about that? When I lost my father 4 years ago, I was already a therapist. I went back home. I knew he's dying. So for this last 6 weeks of his life, I was next to his bed. So before that, I was working on grief with many of my clients. I felt I already know about the stages of grief. I know what I'm doing. But something hit me, which was very surprising. When I sit next to my father and I was grieving there, which was the best quality time I ever had with him in my life. And I'm so grateful for having that chance that I could spend that much time with him. But I noticed, wow, what I'm experiencing right now is what I experienced when I moved to the US. It was very similar emotions. So in the past 4 years, when I came back to the US, I started to develop Raha Foundation. And I go to many places, I talk to my clients, I talk to other people, and I can tell you that there is no workshop for people that they don't have tears when I talk about my immigration and my grief, because they can connect and they say, wow, that was my experience, or that is my experience right now, and still I'm grieving. And every day I notice, I want to say a joke to my son, he doesn't get it, even he knows the language, but I just feel, it doesn't matter, that's okay, I don't want to share because he grew up in a different culture. That's a big grief for me. So something I really want to, my hope is we get today, that at the end you have a better picture of immigration and you know how to work with immigrants. And the good news is that we can use this superpower with Iranian. It works very well. Actually, I love what you mentioned about individualistic and collectivism. I think that's a big part of our work with Middle Eastern or people from different cultures. Because if we don't know about the difference that how they treat each other, how they feel in individualistic culture rather than collectivism, we can diagnose them in a very wrong way. Oh, they are from enmeshed family, or she's borderline. I noticed it happened a lot when I talk to my colleagues and they ask me questions and say, don't you think she's borderline? No, that's part of the culture and it's very normal. I'm not saying yes, we have borderlines in our culture, but it's very important to see people in their culture rather than your own experience. Actually, the reason I titled the name of this post, Can You See Me? That was exactly my point. Can you see me without all these boxes? Don't put me in a box. Just see me and see me as a person, who Gila is, rather than the boxes that we build. I was thinking actually last night that when I see a client from Middle East, what I'm more concerned in the first session when I want to get assessment, what are the questions that I ask them? One question that is very important for me to know how long they live in the US. Because it's a huge difference when recently they came to the US rather than they have been here for 20 or 30 years. It shows their preparation much better. And it's very important to know how they come to the US and why they came here. Many of them, they just come for a better job or going to college. Many of them, they have, because in their country they are not safe. So it shows a lot about their trauma, their experiences, and what brought them to the US. The biggest point is if they have, when they came to the US, do they have any support here? Do they know any people here? Do they have friends and families here? Again, that's another huge piece of information. For me, immigration was very difficult because I didn't know anybody here. Like we came, so I had to find friends. I have to, even I remember I had to drive 20 minutes. I usually give myself 3 hours. Open the map, like huge map in the car, and because I was too shy to ask the address, I had to find everything by myself. So I knew if I had friends or families here, then it was much easier for me. Ask them about their family role. How is the woman's role in their family, men's role, kids, how they feel about their parents' role, who was in charge in their family. It was mother, father, or kid. The funny thing is children, my understanding is in Iranian, especially family.
You find you run into situations where one member of the couple is much more Americanized and more unless traditional, the other member is still traditional, at least that's the way you're supposed to do it.
And that's really difficult.
Can you repeat the question, please?
I'm sorry?
Repeat the question. I couldn't hear the question.
I asked if she runs into situations where one member of a couple is much more Americanized and assimilated, and the other one is much more traditional and thinks this is the way you're supposed to do things, the way they were done in Iran.
And you ask me who are the most difficult couples, I said those couples. They have different values, and it's very hard they see each other. So one of the questions I could hear, ask about their values, what's really important in their life. One of them, they talk about their family, my kids, and the other one talk about school, having a better job, I want to be successful, and it's very hard they can see each other. Something I noticed many times that in our culture, we sacrifice for our kids too much. When we have, I remember all the time I hear from my parents that I'm not important anymore because I'm a mom, because I'm a dad. So kids are very important, but the other side, they don't see their kids. Like emotionally, they are not very connected. They just feel that, okay, I sacrifice for you, but you have to listen to me. You follow me. You have to go to the school at the major, like the job you get, you have to behave well. So we talk about this more in the minutes too. Shame and guilt in our culture is different with what you experience here. So you have to be more careful when they talk about their shame. Many times maybe it doesn't make sense to you. One of the examples I can give you, a client called me and said, can I come and see you? I said, what's the reason you are seeking therapy? She said, because my sister is so angry. So her sister is angry, she's coming to therapy because she experienced a huge shame that how can I help my sister? So even sometimes for me it doesn't make sense that your sister is angry, you want to come to therapy. Can I come to therapy? Why? Because my cousin is alcoholic. So that's part of the collectivism culture, that we are all together. If you have a problem, it's my problem. We don't have, it's my problem, it's your problem. This is something came from English to Farsi. It's always our problem. If a family member has a problem, it's our problem. And you can see a lot of somatization, especially for women, they talk about backache. When you say, how do you feel? They said, I have headache. When they want to talk about their emotion, they go back to their body a lot. I hear from men a lot, they talk about backache, and women, they talk about headache, stomachache. And actually, that's another reason they come to therapy, because many times they come to therapy and they say, like myself, my physician sent me to therapy because I have a lot of stomach ache and they cannot find anything. They said, it's good to see a therapist. The hardest part, still for me, is setting boundaries. Because boundary has a different meaning in different cultures. So it sometimes is very frustrating. I think the best way we can do, just be very clear about our boundaries, about being on time, about payment, about anything. But I think it's great to be clear. The other part, I feel it's great to be flexible in the part that you can be. If you don't accept gift from other Americans, it's okay to accept gift from Middle Eastern culture because it has a different meaning for them. I think they get this feeling of rejection if you say, I'm sorry, I don't accept gift. I hear this story from my clients. They come to me and they feel, I don't want to see my therapist again because I brought something from Iran and she said, I'm sorry, I don't accept gift. And it's very painful for them. The last thing is domestic violence, alcohol, drugs. Let me just say something before I talk about this. Anything I'm saying is based on my own experience. Please keep this in your mind. Of course, I study and I research and I read a lot, but everything I'm saying is based on my own experience. I'm not talking about all Iranian therapists or all Iranian clients. So,
how did you resolve that conflict about accepting gifts or not accepting gifts?
Honestly, for me, it's not an issue. I even sometimes they tip me. And I said, that's wonderful, it's very nice of you, I accept this, but let's talk about this. And so when we open it, that how do you feel about this? Sometimes it's Like they want to cross the boundaries. Of course, I say there, and I said no. But I try to be flexible. So we talk about this without making them feel shame that you are doing something wrong. We just talk about what's happening here, and then they stop. They just, because they want to please me, and when they know I'm pleased, they don't need to do it.
Thank you.
Would you like to be a little more specific about the meaning of gift giving in the culture? What specifically it represents, or what it means to people, so that it would be very important for therapists to accept it?
It's interesting you say. I was in, the question was the meaning of gifts in our culture. I was in Sacramento in EFT therapy with Nancy and Paul, and I loved that experience. It was, for me, it was more than learning something. The last night I was leaving, I had a feeling I have to leave something here. So I went to the downtown, I tried to buy something meaningful, and I was aware of that feeling that of course I could tell them that I appreciate what I learned, but I felt I have to leave something here. So at the end I just bought some flowers, and I gave them flowers. So I think part of that is the meaning of gifts is it's more helpful rather than words. It was hard for me to go and tell them. It was not hard, but I just, it wasn't enough to say that how much I enjoy your training, just that I'd like to give you something. And especially food has a big meaning. We love to feed people. I remember when I was, that's another shameful story, but I think it's important to share it. We had American guests in our home, and I tried to make a very nice setup, a very nice table, and I put food in their plates. Take this chicken, take this pizza. And she was, I don't have chicken, I don't want to have chicken. And I just felt so shameful that why, and my husband told me, why you are feeding them? Put this on the table, they can't take it. But for me, I just felt this way. I can tell them that how happy I am that you are here, that just help yourself, just be comfortable. I'm so grateful you came to my home. I was talking to another therapist that was very interesting. She said I was dating a guy, and the first day we went out, he poured milk in my milk for me without asking me. And she said I can't have milk. So they didn't see each other. And she said he was very nice, but it scared me when he did it. I just felt he doesn't have boundaries. She felt that he was controlling the situation.
Add something. You know, when I was in Morocco, I stayed in a home, a friend of mine, and when we were leaving, what part of the culture I came home with was the gift is that I'm expressing my heart. That's what I felt, you know. And so a word is thank you, but when when I left and she gave me something of her own, and I had brought something for her, it was like we left each other part of our heart.
Exactly. I love that. Last thing I wrote is about domestic violence. Again, based on my experience, 90% of Middle Eastern, not Iranian, Middle Eastern, if I see friends from Afghanistan, Pakistan, there's always domestic violence. I don't know if it's about my cases or it's so common in their culture. It's very sad, and the sad part is they accept this. They feel this is okay. Of course, he's my husband. He hates me because he loves me. So it's very hard to work on it, especially when they don't complain. They feel that's part of the culture. What I experience in Iranian couples that there is sometimes domestic violence, but the woman is abuser, not the man. Woman, the female part is the abuser. I laugh because I just know there are stories that they feel I'll do it because I can do it. I'm in US, you cannot do anything. And many times they take advantage of this. So in both the alcohol and drugs, I see my clients, but most often they are functional. We know they are alcoholic, but it's hard to label them that we have alcohol issue. So I think it's good to keep this in their mind. And the last thing, having an affair, again, something I noticed a difference between Iranian clients and American clients. I noticed that Iranian clients, women and men, they accept affair much easier than Americans. I know my husband is cheating, but it's okay. I care about my family. They want to keep their family together. They are, many times they are in denial, and then I just push more and more and get some information that, yes, I saw his text, or I saw her car parked in front of her boss home, but I just ignore it because I want to keep my family. So many times family is more important than our relationship.
So both the husband and the wife, depending on one will be more accepting.
Right.
What did you say?
For both of them is more acceptable. I mean, so the other side is divorce is horrible. Like I accept anything, domestic violence, any affair, anything I have, I can accept this, but not divorce. Which when I look at my American clients, they cannot accept having affair or cheating, but very easy they talk about divorce. So it's again, I feel it's part of individualistic and collectivism. In Middle East culture, there is a lot of secrets and dishonesty. Part of the secret is we have to keep our family nice. I don't want to share anything bad about my family. But the other part, since I was a child, they teach me to lie. You never talk, we have alcohol at home, it's dangerous. We dance, we have party, no, we didn't have dance. You go to school and you say we were praying. Like we have hijab outside, we come home, we don't have it. Like there is a lot of that disorders in our culture that they teach kids. I teach my kids when we go to Iran that you don't talk about this, you don't say I'm American, when you are outside you don't speak because you have accent. So we learn from very early age that we have to keep a lot of secrets and we have to lie. So when they come to the session, that's part of them. So when you ask why you got married to this guy, say, oh, because I was in love. Yes, you saw each other one time on FaceTime. And you were in love. So sometimes it's hard to say that I really wanted to come to the US. And I'll try to talk about this very openly. That if that's part of the reason, if he's mad of you that you accept this, right, that's okay. I understand that you were not happy in your country, you wanted to come here, there's no shame. And then they start to open up more. So it's not easy for me to say this, but when I get information, I'm not saying I don't believe it, but I know there is more under this, and gradually they can open up more. Something I would like to bring up, another thing that maybe we don't notice that many times they have survival guilt. And that's a big part of their anger. I'm here, my family, they live in Iran, I have a good life, they don't. And they really don't know what's going on. I remember that feeling for my husband that I felt, because I came here for his work. And especially when my father was sick, I noticed that I'm mad of him, that I want to be home, I want to, the last few years of his life, I want to be there, but I have to stay here for you. And it was a lot of survival guilt, that I have better life, I feel bad for my family. And the other thing I just think is in the other vignette, that there is a lot of issue with in-laws and with parents, like guilt for the way they feel guilty for their parents, that I'm not a good child because I have better life, and also a lot of conflict with in-laws. It's almost part of every session I have with individually and couples and family with Iranian. They always talk about their in-laws, that there is no boundary, but they feel shame, they feel guilty. I think that's another piece that it's very important when you are taking assessment, just ask them that do they live here or in Iran and how is their relationship? And you get a lot of information when you ask about their in-laws.